with senior advisors. I wanted to create just a short video here to highlight some of the changes that Medicare has made in 2020 based upon the COVID situation, and some things just to be aware of that are out there. There's some good resources on Medicare's website that highlight these COVID. The first area to COVID will require no out-of-pocket costs, so you shouldn't have to pay anything out of pocket if you're on Medicare and you have any of these COVID-related services. So that's something for you to be aware of. This also applies to Medicare Advantage plans, so that's a good thing as well. So you don't have to worry about those out-of-pocket. Is a way for you to get services from your doctors, providers, specialists through virtual means. It could be a phone call. More likely these days it's a video type interaction, video call type interaction, and you could be your primary doctor, it could be a specialist, a clinical psychologist, social worker, physical therapist, occupational therapist, and other specialists as well. That Medicare has opened up the ability to use your Medicare coverage for telehealth related services. So you don't have to actually physically go to these doctors, and they can see you virtually and provide service to you and still be able to bill Medicare and have your coverage pay for that service. So this is really the direction that a lot of insurance has headed to over the last health insurance over the last several years in the group market, and things are continuing to migrate there. 2020 was a huge impetus to accelerate that migration because of obviously the COVID and folks not wanting to go to the physical doctor's office. So this is something that's available to you. Obviously, if you have an emergency, a heart attack or a stroke or broken limb, you're not going to use telehealth. You're going to go to the ER or wherever you need to get that service. But for basic other types of appointments, you can use telehealth services now. Another change that they made due to COVID was around enrollment flexibility. So specifically what they're trying to do is help people that were impacted by COVID and they missed an enrollment window, for example. And if you missed an enrollment window due to some sort of COVID situation, there's more flexibilities that Medicare is providing to allow you to enroll at different times and use one of these special enrollment periods. So this is really for people that were impacted by COVID and missed an enrollment window. And they also added, for folks that are past the age of 65 that are enrolling in Medicare, prior to this year, they had to go to the Social Security office to drop off forms that showed proof of coverage, so they weren't penalized for enrolling after the age of 65, or they could mail in those forms. This year, they added a new fax number where you could fax those forms in, and they also added a few months ago an online portal where you can enroll online and just upload documentation that shows proof of coverage, so you're not going to be penalized for not having the Medicare Part B since you were 65. So this is a nice new method to enroll after the age of 65 that was not available prior to this year. And again, they really did this because of COVID. So those are the main highlights. So I just wanted you to be aware of those impacts as it relates to COVID and Medicare. And you can find more, again, just to go back to that website if you want to find. And we hope you have a great week, and you take care.